Now we can pause the video and you can try to find out what is the problem in this ECG. Now when we see very closely, we always know that a P wave should be followed by a very nice QRS, and then it should be followed by a T wave, and that's all. The same pattern should be followed: a P, QRS, T, P, QRS, T. This should be the pattern that should always be followed. But in this case, what is happening? If you can see very nicely here, the QRS complexes we can see very well. So if we want to calculate the heart rate or with the ventricular rate, it is very easy. It is 300 divided by total number of large squares. Now the large square is around 1, 2, and 3. So the heart rate is around 100. The ventricular rate is around 100. But what are these waves? This is 1, 2, 3. So these three are called flutter waves, or we can simply see a sawtooth shaped waves, which we call it as flutter waves. So these are basically atrial originated rhythm or atrial originated impulses or flutter waves, and this suggests that there is atrial rate is different. This is a atrial rate. So whenever we want to calculate the rate, what we simply do is we divide that by 300 divided by number of large squares. So when you try to divide this to this, so this is around one large box. So the atrial rate is around 300. So these are the flutter wave. In between the two flutter waves, there is around one large box. So if you want to calculate this atrial rate or flutter rate, we divide 300 divided by 1. So it is 300. But in this case, the ventricular rate is like 1 box, 2 box, 3 box, 4 box. The ventricular rate is 75. That is 300 divided by 4. So here the ventricular rate is different in different uh, strips. So here the atrial or the flutter rate is different. It is around 300. We can 100% see these flutter waves or sawtooth shaped waves, which are called flutter waves, which are undulating atrial impulses. The ventricular rate here is 100, whereas the ventricular rate here is 75. It means that there is a block. So this atrial rate is not completely carried out to ventricle. It means there is a block. There is a block of 3 as to 1 because atrial rate is around 300 and ventricular rate is almost third of the atrial rate. Whereas here the atrial rate is around again 300, but the ventricular rate is around 75. Means only around fourth impulse is carried down to the ventricles. So this tells us that this is a typical atrial flutter with variable block. Somewhere it is 3 as to 1, somewhere it is 4 as to 1. So if you want to diagnose or label atrial flutter, you must be able to see this undulating saw scaled type waves with heart rate around with the atrial rate around 300 and with definitely ventricular rate of around 75 or 100 or 150 depending on the block which is present there. The treatment of choice for this is beta blockers. We commonly give the beta blockers, and diltiazem verapamil can be also given. And in those cases where the patient is unstable or patient is not responding, not reverting, cardron can also be tried. Thank you.